Hello everyone, my name is Moon and today I'm going to present addressing patient concern. This presentation addresses a patient-led major concern and an unsettling experience that at our healthcare facility. We focus on patient satisfaction and legal and ethical healthcare compliance by providing comprehensive analysis, suggestions, and actionable steps to address the concerns. As administrator, we understand the importance of taking care of and following the legal and ethical framework discussed in class. These debates strive to address the current case under review and emphasizes our dedication to continue enhancement and the well-being of all our patients. I encourage your active participation as we explore this issue and find a solution that uphold our values. The patient assessment of their visit with Dr. Raham showed that it did not match their expectation, resulting in serious issue. The patient initially optimistic about a health remedy had a difficult position. Dr. Raham brief commitment and a medical student early assessment made the patient feel alienated and undervalued during a health crisis. Due to Dr. Raham's absence and the patient receiving a generic from letter with already given blood result, communication broke down, making the issue more urgent. The patient is concerned about Meldine blood test result showing elevated liver enzyme. The patient is worried since there was no explanation or treatment for urgent health difficulties. Lack of understanding increases the patient worry, requiring a quick and obvious resolution. Let us focus on the urgent need to address this issue and ensure that our action reflect our commitment to patient-centered care and ethical medical standard as we discuss this issue. Chapter 13 emphasizes patient right, autonomy, confidentiality, and informed consent. Chapter 12 promotes clear communication and collaborative decision making between healthcare provider and patient, especially with patient permission. According to Vanfield, a 2020 legal reporting requirement ensure compliance with regulation that protect patient that and our healthcare system. Chapter 14 emphasizes the necessity of ethical healthcare conduct for trust and patient-centered treatment. We address these legal and ethical issues and find that our compliance with these principles meet regulatory criteria and show our dedication to ethical and empathic and patient-focused healthcare. The patient experience raises concern about autonomy, disclosure, and decision making. Effective patient rights require clear and extensive communication between healthcare staff and patients. This includes communicating medical information and helping patients comprehend their enlightenment, treatment options, and outcomes from Vanfield 2020. Patients must actively participate and understand before medical intervention to give informed consent. We aim to fight any infringement of these rights by carefully examining the patient's contact. Hospital administrator must stress patient rights and foster open communication and informed decision making, according to Naziha 2020. These are crucial to our patient-centered treatment philosophy. The patient letter suggests using ethical standards to analyze Dr. Raham's behaviors. The brief patient interaction and impersonal letter raise questions about patient-centeredness and the ethical need to prioritize patient well-being. Ethical healthcare requires strict compliance with regulations, compassionate care, adequate communication, and patient participation in decision making, according to Van Thiel 2020. Let's consider the ethical improvement to Dr. Raham's behavior. We can create an ethical framework that meets legal criteria and coincides with our commitment to providing ethical and high quality treatment by stressing empathy, encouraging a patient centric approach, and using specialized communication tactics. The, the initial evaluation by a medical student without Dr. Raham fragmented patient provider communication, miscommunication about Dr. Raham's absence, and the patient boilerplate letter exacerba- exacerbated the matter. These malfunctions hinder the patient's medical understanding and cause disdain and exasperation. Poor communication greatly impact patient satisfaction and outcome. According to SCORE 2020, it damages trust, lower patient faith in our healthcare service, and hinders patient engagement in their care. This case highlight communication barriers and the necessity of the need for a robust, uh, unambiguous, uh, patient-focused protocol. We can improve patient satisfaction and healthcare outcome by fixing these issues and demonstrating our commitment to high-quality treatment through effective communication. Next one is recommendation. First and foremost, response quickly and compassionately. Restoring confidence requires immediate communication with the patient, apologizing for the failure in communication and explaining the solutions. Our communication techniques must be thoroughly examined moving forward. Early and clear communication is crucial throughout the patient journey, from scheduling visits to presenting results as suggested by Call 2019. Healthcare worker should get frequent training on empathy and patient-centered communication to promote compassionate care. And additionally, patient feedback and follow-up must be established. This will address problem and provide new ideas for improvement. We prioritize patient requirements by incorporating patient feedback into our practices. Our guideline emphasizes rapid communication, openness, and compassion in patient interaction. These measures address the issue and improve our commitment to patient-centered, empathic healthcare. Conclusion. To conclude, review the important point. The patient's encounter highlighted communication, patient entitlement, and ethical healthcare practices. A multifaceted um, approach is needed to address these issues. We never stop working to please patient. We must follow legal and ethical guidelines while interacting with patient, protecting patient rights, and encouraging open empathetic communication are crucial to this goal. We prioritize constant improvement, the ideas address present issues and improve healthcare practices throughout time, communicating quickly, being honest, and being compassionate, strengthening our commitment to patient-centered care. Transparent communication with the executive board is essential for growth. Collaboration is necessary to modify and maintain our healthcare center ethical, compassionate, and high quality care. May this discussion inspire positive change. We will address the challenges and strengthen our position as leader in providing excellent healthcare by prioritize patient satisfaction, following legal obligation, and continuously enhancing our service. Thanks for your time. I look forward to discussing and improving our healthcare procedures. And here's my references.